All right, thank you. Well, I want to recognize everyone who participated in this needs assessment. I want to recognize our health department. And I want to also acknowledge that it was in 2023. It was my first year in office that we brought forward a motion asking our staff to begin to collect SOGI data, sexual orientation and gender identity data, to help us make better decisions. And we are proud to see that that is now coming forward here 3 years later with a comprehensive needs assessment. I know a lot of work has gone into this, so let's jump into the report.
Thank you so much, Mayor. And good evening to all of you council members. I'm excited and honored to present to you an overview of our Long Beach LGBTQIA2S plus Community Health Needs Assessment and the development of the SOGI data collection best practices. This was a collaborative effort including those represented on the slide and more. Community partners included representatives from APLA Health, Melissa Marquette, Earthlodge Center for Transformation, Cynthia Ruffin, Long Beach Forward, James Swasso, Peter Madsen, and Diane Burkholder, KUBO Organizing Project, Romeo Garcia and Jaslyn Pastor, and the LGBTQ Center Long Beach, Violet Rodriguez and Peter Beck. To support data collection and analysis was Young People to the Front, including Dr. Jeremy Gibbs, Dr. Robin Petering, and Fatine It Hadu. At this time, I'd like to invite to the podium Ellie Perez, Melissa Marquette, and James Swasso. This project has 4 main goals that guided implementation. The 4 goals were to assess health needs and factors impacting quality of life for LGBTQIA2S plus individuals in Long Beach, to identify current resources and assets available individuals in Long Beach that promote health and support well-being in the community, to understand best practices in collecting demographic data related to sex, sexual orientation, and gender identity, commonly referred to as SOGI, to facilitate a community-driven proposal that leverages the strengths of the community to address health disparities and advance health equity for LGBTQIA2S plus individuals. At this time, I will turn it over to our coordinator, Ryan.
Good evening, Honorable Mayor, council members, community members, and fellow city staff. My name is Ryan Magadini. My pronouns are he, him, and I am the LGBTQIA2S plus Health Equity Coordinator with the Health and Human Services Department. This project consisted of 3 major components that you'll see on the screen: listening sessions, a community survey, and community events. The listening sessions that occurred last fall were to garner priority topic areas from community with the intention of capturing perspectives from various subpopulations. The community survey that occurred this past spring and summer gathered more quantitative data on the prioritized health topics among a wider audience. And the community events help provide real-time feedback into the data and implementation of the project. Feedback on the best practices for collecting SOGI data was gathered from community members at each touch point of the project. Included in the final report is an overview of sample questions as well as suggested implementation strategies, cultural considerations, and translation recommendations. Collecting SOGI data whenever demographic questions are asked is essential in understanding the different needs and experiences of the LGBTQIA2S plus community. It allows city programs and services to be more responsive to the diverse LGBTQIA2S plus community in Long Beach. Simply put, if we don't ask, we don't know. In addition to the best practices outlined in the report, a standard of practice for collecting and reporting sexual orientation and gender identity is in development for consistent data collection across the health department. And if you have any questions about the best practices that are outlined, please reach out to myself and I'm happy to discuss further. This was a public health surveillance project that was modeled after a community-based participatory research framework where community members are engaged throughout the process. Topics of analysis are prioritized by community members. Knowledge and insights are combined with action, and there is shared leadership and implementation. The project used convenience sampling with community outreach conducted by community partners, primarily recruiting individuals who live in Long Beach who are over 18 and who are part of the LGBTQIA2S+ community. All participants were compensated with a grocery gift card for participating. 8 one-hour listening sessions were conducted with the following subpopulation: Latinx folks, Black folks, Filipinx folks, Cambodian folks, transgender, gender expansive and intersex, or TGI folks, youth, older adults, and folks with disabilities. The listening sessions provided priority themes that guide the survey development, and which consisted of 61 health and quality of life related questions. And now I'm going to pass it over to Ellie Perez.
Thank you, Ryan. Good evening, Honorable Mayor, Council members, and city staff. My name is Ellie Perez. My pronouns are she, her, ella, and I am the Executive Director of the LGBTQ Center Long Beach. And today, I'll be presenting to you the demographic information of the participants of the needs assessment. There were 447 participants. Almost 70% are people of color. 47% of the participants are TGI. 31% of participants have an income of $20K or less. 60% were between the ages of 25 and 44. 17% of the participants' highest level of education is a GED, and 40% of them are single, and 18% live alone. Safety, violence, and community support emerged as a central theme across many subpopulations during the listening sessions. When asked about confidence in going to the police for help in the community survey, 59% of participants reported not feeling confident, even higher among TGI folks at 77%. Moreover, of the individuals who experienced violence or a hate incident, only 21.3% reported the incident, suggesting a reluctance to engage with law enforcement. Unfortunately, participants reported a great deal of support. Well, fortunately, participants reported a great deal of support from community, with 82% of participants reporting having places they feel comfortable socializing, and 84% reporting friends and relationships that they can turn to for support.
James is next.
All right, good evening, Honorable Mayor and Council members. My name is James Suazo. My pronouns are he and him, and I am one of the members of the Project Advisory Committee and the Executive Director with Long Beach Forward. Fun fact, I don't know how to swim, so I appreciate all the equity-focused programs. Now I know, so this is awesome. So across the data, I'm gonna talk a little bit about our findings in housing and homelessness, and one of the things that we found were that income disparities were prevalent, particularly in housing and homelessness. 1 in 4 people reported experiencing homelessness in the past year, whether this was staying at someone else's home, in shelters, outside, or in motels. Only 6% of people surveyed spent most nights in a shelter, while 64% reported couch surfing with someone that they knew. When asked about their emergency shelter experiences, 50% of trans, gender diverse, and intersex participants felt that shelters were affirming to their gender. Overall, 76% of those who experienced homelessness are people of color. For people with permanent housing, rent costs are still a challenge. 74.2% of people reported spending 30% or more of their income on rent, while 22.2% reported spending 60% or more of their income on rent. And of the 60%, 31% identified as TGI, as compared to 14% who were cisgender. 30% reported to be unemployed. Among those who are employed, 57.6% reported additional income. The most frequent sources were from welfare agencies, money from friends or relatives as mutual aid, and vending. 44% of cisgender participants were less likely to have reported additional sources of income beyond employment, while 83% of TGI folks relied on additional sources of income. And now I'll pass it to my colleague, Melissa.
Good evening, council members. My name is Melissa Marquette. My pronouns are she, her, hers, and I'm the Gender Services Program Manager at APLA Health, right over on 10th and Elm. I'm also a member of the Project Advisory Committee, and I'm going to speak a little bit about mental health. 64% of the respondents reported diagnosed with a mental health condition in their lifetime. Looking at this figure by gender, there is a disparity between TGI and cisgender participants, with 80% of TGI participants compared to 51 cisgender participants who indicated having a mental health condition. A quarter of all participants accessed mental health crisis services in the last year. In the community survey, we asked participants about barriers to mental health care, gender-affirming care, and sexual health services. Top barriers to accessing mental health services included difficulty finding an LGBTQIS affirming provider, difficulty getting an appointment, difficult paying for services, and not knowing where to care. Thank you. I'll pass it back to Ryan.
Based on the data that was collected, there are some key areas where support for the community is needed. Housing and homelessness emerge as a top priority for participants. Specifically, TGI folks experiencing homelessness face unique barriers because of their gender and experience homelessness at a disproportionately higher rate. Rent burden is another stressor for participants, as more than half of the participants are spending 30% or more of their income on rent. Despite several affirming and supportive LGBT-focused healthcare providers in Long Beach that we are lucky to have, access to care remains challenging and was another top priority for participants. Finally, violence and community safety emerge as a significant theme. Over half of respondents spoke of not feeling comfortable engaging with the police. Therefore, support is needed for victims of crime reluctant to engage with law enforcement, to report, or to seek support services. Regarding next steps, we are planning a health summit, which is being led by Long Beach Forward, James Suazo, in collaboration with the Racial Health Equity Team, LBCC, and other community partners. At this summit, we'll be presenting a more comprehensive overview of this project, the report, and the findings, so we would love if city council members in the community could attend to learn more. Additionally, we will continue to focus on disseminating the results to the community and action planning collaboratively with community partners to address the needs. Thank you all for listening, and thank you all so much to the community members and partner agencies that were part of this initiative and joined us this evening. Take care and good night. Oops, we can go back.
All right. Work, check, okay, all right. Well, thank you so much for that presentation. Let's hear it for the community leaders who participated and presented tonight. Thank you so much for being here. It's a late night and you are hanging out with us, so thank you, we appreciate you. We're gonna now go to the city council for remarks. We'll start with Councilmember Allen.
Yes, thank you very much for being here and everyone that presented. I also want to sincerely thank the Department of Health and Human Services, especially the Racial Health Equity Team, for their time, care, and effort that went into all of this research. This important work reflects a real commitment to understanding our community, not just through data, but through real lived experiences. I especially appreciate how the intersectionality was taken into account throughout the process. The assessment recognizes that people do not experience health, safety, or access in isolation, and that overlapping identities shape real outcomes in meaningful ways. I also want to acknowledge the effort that it takes to build trust, particularly when communities, particularly with communities that have experienced have been historically marginalized and or overlooked. The relationship building is critical and is clearly strengthened, which clearly strengthened the work. And this research matters because Long Beach is a city that absolutely strives for diversity and equity. And so efforts like this help to ensure our policies and decisions reflect those values and move us closer to being an inclusive city. And that's what we all aim to be. So thank you so much. Thank you for all the presenters, and thank you for all the research.
Thank you, Councilmember Kerr.
Yes, I want to thank the community leaders who were engaged in this process and to our city team for bringing people together. Just to echo Councilwoman Allen's process, this is about data, but it's not about data. And the ability to bring community members into a formal process that is facilitated alongside community members in the city can do some real restorative and reparative work for people who've lost faith in the city's ability to see them, to find services for them, and to support and uplift them. And we have a long road with some of our communities to do that. And so I'm thankful for everyone coming together to give us the chance to rebuild relationships that we've lost over time for not being responsive and being harmful at times in our history. So thank you to all of you for being here, for that continued work, for your continued or growing faith in us and trust in us to stand by and do right and support our diverse communities and to build back some of that trust with our institutions. So I look forward to the what's next. Health summits and all of those things continue to keep people in the fold who for a long time felt like they didn't have a space with us. So thank you for inviting us into the process alongside community, and keep us informed of how we can continue to support.
Thank you. Next, we have Councilmember Sorrow.
Yes, thank you. I want to also add my gratitude to Ms. King, the health equity, racial and health equity team, as well as community leaders and all those working hard to making sure that we have a diverse and inclusive survey participant, because it's so important to be considerate of the histories of where all the individuals come from, because there are traumas that's been set up, and added to that the sexual orientation and identity, and how do you even have language to even talk about it? It's one thing if you can do it in English, another when you don't have the language for it. I'll share a story in that I have a cousin that just that came out as transgender, and I think for the longest time it was really hard for my uncle and aunt to even let us know, because they were mourning the loss of Eric and figuring out who the heck Erica is. But it was really hard for them to figure out how to tell family members because there's no specific terms for it. I can't imagine the amount of, mental process they had to go through, an emotional process. And I think that this report really just demonstrates validating that it's very real, all of these level of identity and different levels of trauma that exist, in order to identify the correct resources to do so, and consider how do we ensure that we are advocates and champions to making sure that it's very important that we don't just have these very just general health access. There is a reason why it's very specific to the LGBTQIA2S plus community or the Black community, because the data is showing that there is major disparity and need. And so thank you. I like to see this as a start for us to continue building and having conversation and making sure that stories are at the forefront to actually getting investments in place to serving those in need. So thank you.
Councilmember Thrashintook.
All right, yes, thank you. So I too want to thank Director King as well as team member Ryan Maganini for bringing this presentation forward this evening. I believe that this community health needs assessment is an affirmation to our LGBTQIA2S plus community, and really shows that we're committing ourselves to understanding how the community is feeling within our city and what we can do to serve the community better. I really truly appreciate that all of these health assessments that you've done have centered the people with the lived experience. So not only have you centered them in the questions, but you have engaged the leaders along the way, and always to have the community come and present to us alongside you is so impactful. And the fact that the communities have all been willing to do so and to share their experiences in meeting with others from the various various communities, I think just speaks to how well the staff has been able to engage and get really good information from all communities. When it comes to this particular health assessment that's been brought before us, I do want to make sure, as someone who's concerned about housing and access to it, that we lift that up and spend a little time on that. I noticed that 31% of survey participants stated that they have less than $20,000 in income or less even, and 1 in 4 has already been noted, James, that are experiencing homelessness. And so LGBTQIA folks in our community really need additional support in this area. And we know that once you have housing, then you have health services security. We saw the mental health needs, job security, and overall well-being. So given that, just wanted to see Director King and maybe the rest of the staff, if you've given some consideration as to what we can do from a homeless outreach perspective to make sure that we're addressing our transgender, gender expansive, and intersex community members who may be experiencing homelessness or maybe just even rent burden.
So through our Homeless Services Bureau, we do ensure that we have staff with lived experience who are able to go out and go into the communities to support the community in ways that are specific to their needs. We have a very diverse staff within all of the Department of Health and Human Services, and we work within each of our bureaus to collaboratively support all of these different groups. As you know, the challenge of homelessness is pervasive throughout, and we do all that we can to connect people to places where they feel safe. One of the important pieces that came from this is that there is gender affirming service rendered in our shelters, and beyond even those that are city operated. So we as a city are doing all that we can to ensure the safety. We've also engaged with PD, and there may be an interest in looking to engage participants in understanding how they might feel safer in reporting some of the concerns that were raised in this report so that they are addressed. So we will continue to work in all areas of the report and the findings.
Thank you so much for sharing that. And I have a lot of confidence and believe that we are doing all we can. And certainly I would encourage whatever else we can do to ensure that there's LGBTQIA2S community sensitivity training throughout all of the work that we do that is public facing. And I want to thank the leaders for coming up here again today, for sharing that there is an upcoming health fair. I think that that's so critical to be responsive to what was in the report. And we look forward to details on when that might be in case we're able to participate in upcoming activities. Thank you so much.
All right. Councilmember Zendejas.
Thank you, Director King, for that great presentation, Ryan. That was amazing. To our community leaders, Ellie, James, thank you so much for the work that was done. I know there was a lot of work that went into it, and agreeing with all the points that my colleagues have brought up. But one of the things that I see in this presentation today is that we really have a lot of work to do. And so I think that this is exactly what we needed. As one of my colleagues has pointed out, this is the start that we needed so that we can move our city in the right direction. I feel like it's been way overdue in the city of Long Beach, but thanks to this, we have a start. And I look forward to participating. I look forward to engaging with our community, with our city staff, to really address all of the intersectionality points that are brought up in this presentation today. So great work. Thank you.
All right, we'll now go to public comment. We have a number of the members of the public signed up to speak. Bill Civ, Ellie Perez, and Chi-Chi. And Tanya Martin, too.
Thank you, Mayor Richardson and council members. I don't think, for me, as much as I've been up here in the past, I don't think I've ever shared the fact that during COVID, when I got laid off my job with millions of other people in the country, I actually got certified as a community healthcare worker. So in LA County, I'm an out and visible LGBTQ community healthcare worker. And fortunately for me, I don't have any guardrails, so I can talk about items that aren't really discussed within the structured community healthcare worker framework within LA County. They don't cover some of the issues that we do here. Fortunately, I was one of the respondents to the survey and definitely will be participating in the upcoming summit. But the problem is that some of our counterparts, or that I encounter, are younger, and they don't have that older perspective. For instance, I know of a 70-year-old trans male, but who grew up as a lesbian, a baby dyke, a dyke, a butch lesbian, and at 70 years old came out as a trans male. Definitely afraid of actually his senior housing finding out that now identifying as transgender at 70 years old, the name, that kind of stuff, all these fears that the older side have. And also, are long-term survivors of HIV and AIDS. And when I participated in the surveys that James held, I had that older perspective that I was bringing into it. And I'm in spaces that our city is not. For instance, there is a rotating LGBTQ health conference that rotates between UCLA, USC, UC Irvine, San Diego State, Western University, all of the medical teaching universities. They rotate this LGBTQ healthcare. I'm in those spaces. I'm talking to the educators or the program designers. And that's also where I get educated a lot of transgender issues and a lot of intersex issues. So I get my own education there. Plus, I have a global network which I can pull from. In fact, I just got some new stuff from Ireland, but also, I get to see what they're doing with transgender older adults and younger people in Australia and also in India. So I get to pool all these resources. And I plan to, I've shared them with Ryan in the past. James is very aware of some of the things that I attend. And so I'm glad that the city's moving forward with this, but I'm also glad that I'm in a position where I can bring that perspective, because I'm come from that age where we were fighting against AIDS and access to healthcare and that kind of stuff. And I think one of the things I can bring up, and that'll be my last point, is that the number of older adults that are in subsidized housing that can be, as the contracts expire, may they become homeless, and we need to prevent that. So we'll be sharing with you in the future. Thank you.
Thank you. Next is Ellie. After Ellie is Chi-Chi.
Hello again. Just wanted to say thank you for investing in our community with forums like this. And as we continue to move forward to deliver on what our community needs, we're really going to need your support. And we're going to be coming and we're going to be asking. A lot of what we need is financial support. As you know, the federal cuts to the center have been atrocious, and we are doing the best that we can. We did get finally approved for Medi-Cal billing, so we're really excited for that. But we still need the support of the city. We're at the subject experts in our community. We need your support. So I just want to thank you for everything that you've done so far, but there is so much more work to be done, and it's going to take all of you and all of us. So I just want to say thank you.
Thanks, Ellie. Chi-Chi? Okay, Tanya?
Honorable Mayor, City Council, and hardworking staff, my name is Tanya Martin. Tonight, I'm going to be wearing two different hats. The first one is representative, the LGBTQ representative for California State Insurance Commissioner Ricardo Lara. On behalf of Insurance Commissioner Ricardo Lara, thank you to the City of Long Beach for evaluating the health needs of the LGBTQ+ community through this assessment. As a former state senator representing Long Beach and the first openly gay person elected to statewide office in California's history, this work is deeply personal to him. Throughout his career, Commissioner Laura has been a relentless advocate for the LGBTQ Californians, fighting discrimination, expanding access to health care, and holding insurance companies accountable under the law. From protecting coverage for gender-affirming care and HIV prevention to strengthening non-discrimination protections during emergencies and disasters. He has worked to ensure LGBTQ+ communities are seen, protected, and treated with dignity. This community matters to him, and the Department of Insurance remains committed to advancing equity, enforcing consumer protections, and partnering with local leaders in Long Beach to meet people where they are. And my other hat is President of Long Beach Gay Pride. It's an honor to be here, and I thank you all for your support throughout the years. I also want to thank the Health Department, Ms. King, Ryan, and of course our partners here, Ellie, she did a great job, Long Beach Forward, and of course APLA. I want to thank you very much for watching over our community. As the president of Long Beach Pride, I'm sure that many of you heard about our recent hate crime incident that happened this last year. These are just some of the things that we have to face every day when we walk out the door. As a mother of 4 boys, it's difficult. It's very difficult, and it's scary at times. As a matter of fact, I saw a study today that 50% of our community are now blocking themselves away because they're so frightened. So this study is the beginning, and it's SOGI. Remember the name because you'll hear it a lot. SOGI is a great thing to come to Long Beach, and I'm very supportive of it. And I just want you to know that with all these fear and all the things that goes on in our community, the drug abuse from the fear, suicides have gone up tremendously. And I'm not just saying this and talking to you about people out there. Emotionally, I want you to hear this. I'm right in front of you. This is me. These are things that I go through. And we need you, and we need your support. And as president of Long Beach Pride, we're going to move forward with helping to provide all the services needed for our community to survive, because we've been doing this for centuries, and we're fearless. Thank you.
All right. Let's hear it for all our speakers, public commenters. Daryl, Councilmember Supanoff.
Thank you. Just briefly to staff. On the PowerPoint page 7, there appears to be an error, and that is on the map for the 4th Council District, where it should read 90815. It reads 90809. So if that correction could be made, we'd appreciate it, and make sure that the numbers, the stats, reflect 90815. Thank you.
All right, and before we go to our vote, just want to recognize what everybody said. You know, we hear you. It's, you know, federal government has a full-fledged attack on LGBTQ, our queer residents, and all of our communities that are oppressed. And what this represents here, it's not symbolic. This is a commitment, and it's Long Beach is leading in the opposite direction of where the federal government is going. And I know our city council is going to do the right thing, obviously support this, but I think what we do is what ultimately matters. So thank you so much for coming out. Members, please cast your vote.
Motion is carried.
Thank you. All right.